As a counselor at CNS, I help patients and families form goals by having an understanding of where they are in their lives, what's meaningful to them, and how we can best encourage and inspire them from where they are to where they hope to be. Patient goals really are so individualized for each patient. And so it's really, you know, as counselors here, we tune in to what is meaningful to them. Where are they? We meet them where they are and help them from where they are. It's kind of like GPS. We have to know where we are before we can understand how to get from where we are to where we want to be. And so we work to, and that's part of the assessment process, to understand someone's psychosocial level of development, to understand their background and their history, information we get from them, the chart, medical record from family, preliminary evaluations, everything we can find out to help us better attune to a patient's need and where they are. We use that information, and then we work with them at their pace and their comfort level. And sometimes it's uncomfortable for them, and we help them work through those feelings and process those feelings. You know, really to move emotional suffering, emotional trauma from the amygdala to the prefrontal cortex, where they have better ability to cope. They may need help with that. They may need psychopharmacology. They may need a full endocrine workup. That's one thing that's wonderful here is we get to collaborate with the medical team and rule out any medical condition that could be contributing to emotional distress. Some patients have a harder time coping with no longer being able to work than hemiparesis, and that's okay too, absolutely. And so it's an honor and a privilege wherever we find a patient suffering, just to work with them and where the rubber meets the road and help them however we can.